Hello, my name is Dr. Savak Teymoorian, but my patients call me Dr. T. I originally grew up in Glendale, California, where I got my high school degree from Glendale High School. I eventually moved down to Orange County, where I spent the next 10 years at UC Irvine. I did my undergraduate, my medical school, business school, and internship there, and also had a chance to meet my beautiful wife. I ended up going to Kansas City into the Midwest to do my ophthalmology residency, and then ended up at Stanford University to do my glaucoma fellowship. My wife and I moved down here. We each joined our private practices, and I work at Harvard Eye Associates. What I do in particular here is I provide care for patients who have cataracts and also for those that have glaucoma, sometimes one, sometimes both. What I thoroughly enjoy doing, though, is taking good care of our patients. One of the most important things that I learned, and I learned this from my wife who's a geriatrician, is remember to keep the quality of life of our patients as high as we can. I remember I decided to be an eye doctor when I was just in the 5th grade because that's where I got exposure to this field. And I thought, wow, this is incredible. I get to improve the vision of people. What meaningful work is that? Many years later, and many years of training later, I ended up here, and I couldn't be any more proud to be here. Besides being able to take care of our patients here at Harvard Eye, I'm fortunate enough to be involved in many other ventures. In particular, I was able to write a book chapter along with Dr. Hovanesian that talk about glaucoma surgery in patients having cataract surgery. I'm also involved in many humanitarian activities. In particular, I like to focus in on providing glaucoma care for these patients. These are patients that need care, but unfortunately do not have access to them. And these are the cases where if they don't get access to them, unfortunately it results in blindness. It's very, very rewarding for me to be able to take part in this kind of care for these patients. I'm happy that I'm here, that I can help out people to maintain their vision, most importantly so they can have good quality of life. I really think it's one of the most important things that I can provide for my patients. People commonly ask me, what's it like going through all those years of training? Was it worth it? And I always tell them it absolutely is, because at the end of the day, when people are able to see well, it's priceless for me.